Bore da, croeso. Welcome everybody to the meeting of Powys Teaching Health Board today. Today's meeting is being held virtually and will be recorded and put on our website. I'd like to welcome board members, representatives from the Community Health Council and any observers who are present. I'll introduce myself first. Which is easier in a virtual meeting, I think, than around a table. I'm Vivian Harpwood, Chair of Powys Teaching Health Board. Also present are Mel Davis, the Vice Chair, and independent members Trish Buchan, Francis Gerard, Ian Phillips, Tony Thomas, Owen James, Mark Taylor and Susan Newport. And then the executive team, Chief Executive Carol Schillerbeer, and the following executive directors: Jamie Marchant, Deputy Chief Executive and Director of Primary and Community Care and Mental Health, Julie Rolls, Director of Workforce and Organisation Development, Hayley Thomas, Director of Planning and Performance, Stuart Bourne, Director of Public Health, Alison Davis, Director of Nursing, Claire Madsen, Director of Therapies and Health Sciences, Samantha Moss, Assistant Director of Finance, deputising today for the Director, Pete Hopgood. And present also is Rani, our Board Secretary, whom we couldn't do without, especially today, our first meeting being held in this way. Katie Blackburn, Chief Officer of Community Health Council, and colleagues from the Corporate Governance team will also be supporting the meeting. We've had apologies from Matthew Dorrance, independent member, obviously Pete Hopgood, Director of Finance and IT, and Alison Bullman from Powys County Council. Please note that participants may look away from time to time at their papers, so they won't be looking directly at their cameras during the meeting because they need to access documents on another device. Also, we've received some questions in advance of today's meeting from the independent members. The vast majority of these have already been answered, and a summary will be published to the website. There'll be a link provided on the agenda. So I would ask officers to direct any questions that are yet to be answered as part of their presentation when they come to their part in that section of the agenda. So moving to the agenda, which is published on the website, along with the papers, the first item is declarations of interest. Are there any declarations of interest today, please? No, thank you. So we turn to the minutes of the previous meeting held on the 29th of June 2020 and the matters arising and action log. So agenda item 1.3, the minutes of the last meeting. Can I just ask you, I'm assuming you've all read these, can I ask you please to point out any matters of detail that need correcting, please? Any smaller matters such as spelling errors and typographical errors, please let the board secretary know separately. So page 1, 2, 3, page 4, page 5, page 6, 7, 8 and 9. So can we take it that those are an accurate record of the proceedings at the last meeting? Thank you. Are there any matters arising which are not on the action log? No? All right. Thank you. And can we then turn to the action log?
Shall I come in, Chair?
Yes, please.
There are
yes.
three actions included on the action log arising from previous meetings. I wasn't going to propose that we go through those in detail. Each action is now picked up through either the board development plan included on today's agenda or the board's work plan also on the agenda, and progress will be monitored through those mechanisms. So I'm proposing that those three actions are now closed.
Yes, and obviously they relate to board briefing sessions and board development, so that's great. Thank you very much. Agenda item 1.6, there's an update first from me. Just to say that as chair, this is a very significant day for me personally. My first board meeting back on health board premises since lockdown began more than 4 months ago. So very important, and I'd like to extend thanks on behalf of the health board to all our partners who've worked with us during the COVID pandemic, which of course we know is not over yet, to meet the challenges. Carol Shillaby, our chief exec, will elaborate on those challenges and give her thanks. But I'd just like to say very quickly that I often think of a statement made by Shakespeare in Hamlet. He said, when sorrows, not Hamlet, Claudius actually said this, when sorrows come, they come not single spies, but in battalions. And it has taken battalions of people working together during the pandemic to combat these and work on the challenges. And we do know that we have wonderfully resilient communities supportive of one another in rural areas. And I think today I'd like to pay tribute particularly to our communities. I now turn to perhaps more mundane things. The board's unable to meet in person, of course, and we are doing our best to run meetings virtually by electronic means, as opposed to being in a physical location. Unfortunately, this does mean that members of the public will not be able to attend in person. So we've taken the decision really to do it this way in the best interest of protecting the public, our staff and members of the board. As a board, we are committed to openness and transparency and conduct of as much of our business as possible in the sessions that the public are normally welcome to attend and observe. So we're therefore expediting plans to enable our meetings to be made available to the public via live streaming. That isn't happening today. In the meantime, we're recording meetings of the board and making these available for the public to view. In addition, we've invited members of the public to contact the health board should they wish to observe a virtual meeting in order that the request can be considered on an individual basis. And further details of that are on our website. Turning to the constitution of the board would be aware that we have a vacancy for an independent member. In March 2020, the Public Bodies Unit in Welsh Government suspended public appointments in the light of the COVID-19 pandemic. The impact of this on public appointments across the public sector is expected to be significant, and health boards are working with the Public Bodies Unit to prioritise the recruitment of independent member positions on a risk-based approach, ensuring the stability of boards and the need to maintain that. It's therefore likely that we need to hold this vacancy for a little while longer. We have some excellent independent members, and this is just one that we're waiting to deal with, this new post. But we look to make progress as soon as possible. One piece of very good news, the Minister for Health and Social Care has approved an extension of Susan Newport's term of appointment until September 2021. I'm very grateful to Susan for agreeing to continue with us as an independent member. So thank you, Susan. And that concludes my report. So Mel, over to you as Vice Chair.
Thank you, Viv. Tony, can you turn off your sound, please? Sorry, we've got a bit.
We can't hear you, Mel, at the moment. Have you got your mic on?
Okay, is that better?
Yes.
Okay. Mine is just to say that, no, hang on, I'm really sorry. Could we come back to me? Tony's is feeding back and we'll have to sort it out.
There's an echo. Yes, all right, Carol, if you'd like to give your report first, thanks.
Yeah, thanks very much, colleagues. And so my report has been circulated and hopefully all board members have access to it. There's a couple of things I would draw out. First of all, just to follow on from the Chair's opening remarks, really, about the response to the COVID-19 pandemic. You know, we are still in the pandemic, and the sense of having this slightly perhaps less demanding period from the numbers of cases of the virus itself may give people a slightly false sense of security. So I think it's important to underline that we are indeed still in the pandemic. It isn't over. And indeed, you know, we are looking ahead to quarters 3 and 4 and what could well be a very difficult winter period. We will come back to some of that throughout the meeting and with a couple of the key papers. I did want to reiterate thanks, though, that you have expressed, Chair, to the communities and the tremendous effort that has been made by people across Powys in terms of seeking to observe lockdown measures where they were in place, and now during the easement it is really important to underline the continuing precautions that the public can take at this time, including social distancing and hygiene, and where appropriate consider the wearing of face coverings in enclosed spaces. I think it's really important for me to also share thanks in relation to the efforts and the partnership working that we've had with the third sector and Powys County Council. We were able to resume our regional partnership board meeting arrangements earlier this week, and we took some time to reflect as a partnership on the efforts that have been seen, very visibly felt over the last few months. There's a number of things that we've learned and that we will look to be taking forward as we move through the next 3 to 6 months as well. And also want to extend thanks to those who are working in primary care, just to say that primary care has largely remained open, but had to modify very quickly how people could access those services, and it has been tremendously challenging, but also really very rewarding in seeing the sector change so quickly. That includes as well the care homes and domiciliary care elements of the independent sector, where we've worked really closely in partnership with them. And then finally, the sense of working with other health boards and trusts across Wales and into England. And again, you'll get a real sense through the meeting today of the amount of work that people have undertaken to ensure that each and every pathway of care is supported, and where usual arrangements are not in place, alterations to access are maintained as best as possible. So it was really to reiterate the thanks there, Chair, that you have given, and finally to thank everyone in the organisation. There's been a huge amount of work. I think that we're very pleased with the amount of support that we have had from colleagues and partners, but primarily our staff within the organisation has really pulled out all the stops to help us be as prepared as we possibly could be for what was the first wave, and that we will be again asking them to help us prepare for the winter. Importantly, as we are in the summer period, it's essential for people to take annual leave, and we have been working with the trade unions to actively encourage people to have rest. So that's on the response to COVID, certainly in the early days. We have some of the papers on that. I do want to draw attention to Shrewsbury and Telford Hospitals NHS Trust, Colleagues will have seen some significant media coverage of this organisation and the difficulties there are in providing a sustainable, high quality, effective service. We are working very closely with this organisation and the system stakeholders, both in Wales and in England. And I know that the board will have further detail in relation to the specifics of the findings and the direction of travel in relation to this organisation, and our response and proactive action that we would plan to take. Just to say that there have been very fruitful discussions with Katie, the Chief Officer from the Community Health Council, with the Care Quality Commission, with Healthcare Inspectorate Wales, Welsh Government and NHS England and Improvement over the last few weeks, and we will be coming back to the outcomes of those discussions. Finally, really just to pull out in my report around our relationships with other organisations is in relation to Anara Bevan University Health Board and particularly the Grange University Hospital. I'm sure colleagues will recall that the Grange University Hospital, it was due to open in spring 2021. However, in relation to the preparations that Anara Bevan Health Board have been putting in place for what is likely to be a very challenging winter, there have been further considerations about whether that hospital could and should open earlier. The Anara Bevan Health Board, I understand, is still awaiting full sign-off from Welsh Government, but is proceeding with all of the preparations needed to open the hospital with a date in November. We do have a programme board now established, and we're working closely with Anara Bevan. We will, as a board, be able to spend more time and focus and more detail in this area in early September in our meeting then, our board development meeting, and clearly this will be brought back to the board in due course. And then very finally, we're been focusing clearly on issues of access to services made all the more challenging through the COVID environment. We do have a performance report on the board later on. I did just want to pull out some challenges around unscheduled care and ambulance performance, and the growing challenge around referral to treatment and in particular access times, which I'm sure we'll have further discussion on. So thanks very much, Chair, for allowing me to go through that.
Thank you very much, Carol. There's so much there to absorb. I think that some of the things you mentioned, of course, will be coming up later on the agenda. Now, Melanie Davis, our Vice Chair, I hope you have more success this time.
Okay.
With the sound.
Is
Yes.
better? We turned Tony off basically as far as sound was concerned. As far as sound was concerned. So I would just sort of say, really taking a view from the point of business and our new normal, just to say that the vice chair's roles are back and up and running. We've had our meeting with the minister. We've also had our roles for myself, I do the national psychological therapies and the Together for Children and Young People, both of which have met. And so that's forwarding those businesses outside of ours, which is very interesting to know that actually the whole system therefore is back and up and running. In that regard, you know, they've all been digital. I've also done a couple of interviews, both for the Deputy Director for Nursing and Therapies. We were able to offer a point for the Nursing Deputy Director, so that's very exciting. One was digital, one was traditional, so we've there's that balance now that's happening throughout the board, which is very interesting as well, and sort of supports that digital experience that we're all getting to grips with, she says, really trying to get to grips with her digital experience this morning. So really, I just also mentioned that EQ&S, we've had some extra meetings now that we're back and but not, just to make sure that we're covering the points that we need to. And I really think that that's all. Oh, just also to say, yes, the partnerships, we welcome to see that they're all back up and running. I've been to the Mental Health Start Well and the RPB, and they're all sort of acknowledging that gap, I suppose, and reassessing where we are and sort of recalibrating so that we can carry on and move forward. So that's really my overview at the moment. Thank you.
Thank you very much, Mel. So that concludes the first part of the agenda. Moving to item 2.1, and it's Carol who's going to present this. This item is really for information and discussion. It's very important, which is why we've put it early in the agenda. It's not a matter for approval, it's simply to inform us by giving an overview of what's been happening in phase 2. So Carol, over to you. Can you put your mic on, Carol?
Oh, I'm not quite sure when I'm going to learn, but here we go. Let's try that again. Thanks very much, Chair. You're absolutely right. This is really the overview of our recent work on the pandemic, and it is the precursor to the item that follows, which is actually for decision by the board. There is, without actually writing a report that runs to more than, I don't know, 100 pages or so, it is very challenging to give just an overview of the work that has taken place over the recent weeks and months in response to the COVID-19 pandemic environment. The board will recall that it signed off the phase 2 quarter 1 response plan in May, and what I've attempted to do here is to remind colleagues of the 5 parts of that plan, and to remind colleagues of the arrangements that we've had in place, which changed from the very first planning and preparation part of the pandemic response to reflect really the up-to-date position at May, and it seeks to just pull out some of the really key areas that have progressed. I recognise that the committees of the board have received specific and very detailed reports in a number of areas. So this board report does not seek to cover those areas of the reports that have been before. You know, if executive colleagues do wish to come in and there's any questions of this, please do indicate, and I'm very happy to help. So if I could just give an overview of Test, Trace and Protect, and just to say that this was an element of a new, well, it's a completely new function for us and for the local authority. But I can say that the overall reflection is that the TTP process is now well established. It is working well. We've had regular and consistent leadership and management of this. Particularly through Stuart Bourne and Nigel Bryn, who's in the local authority with the role of Director of Public Protection. We've established a new testing function largely from scratch. It's a completely different approach to the one that we'd had in previously. The tracing function has been established from scratch, as has our data set and our dashboard for TTP. We're learning every week, and particularly in terms of how to respond effectively to outbreaks. Colleagues will see right the way across the country, there've been a number of outbreaks that local services have needed to respond to, and that's been a very important both test and learning exercise in preparation for any future outbreaks as well. So there's quite a lot to learn from this area. We are maintaining a strategic oversight in this area. Myself and Caroline Turner from the local authority, with Stuart Bourne and Nigel Bryn every 2 weeks. You'll also be able to see I've just included one chart. I thought it might be of interest in particular to any members of the public who might engage with this, to see the amount of testing that has been going on. So this was always one of the key areas that has had a lot of profile, is about the availability of tests, and more significantly over the last 4 to 6 weeks or so, test take-up has been much higher as well. We are working, of course, on test turnaround. That is key, that is critical, and we still have an important development plan to fully implement in the area of testing, including the potential to provide more local testing, laboratory type, near patient testing capability. I'll keep going, Chair, until you interrupt me. Harm from COVID. So we had done a huge amount of work in the very early stages back in March on this. So for the phase 2 Q1 response, it was a modification to the clinical response model. That was very helpful to take stock of that, and in particularly to ensure we've got a focus on the elements of the pathway that this health board can in all effectiveness deliver directly, and recognise the role of secondary care where their specific expertise lies. Importantly through this, and I do just want to name Claire Madsen, the Director of Therapies and Health Science here. I think it was probably within 6 or 8 weeks of joining the Health Board, Claire had been asked to co-chair a national work stream on rehabilitation and recovery. And this is really significant, not just for us, but right the way across Wales. I'm delighted that that work has already come through to fruition, is now being used by all health boards. We had a particularly difficult period through April and early May in relation to the impact of the first wave on care homes. That continues to be a significant area of focus, but more broadly on other enhanced care settings as well. And I think we've got about 7 settings in that category at this stage. We have reverted some of the work that was done in those at that time into our more business as usual elements, so that we can focus on enhanced settings more broadly. And then there's some work on early warning systems. Harm from an overwhelmed health and care system. This will be in particular the focus from the Q2 operational plan item that Hayley is presenting next. And in particular, Welsh Government have been maturing their requests to us about how we respond, not just on COVID related matters, but providing essential and routine services in a COVID type context. So a lot of work on that. We have as well commissioned some work on new ways of working, and we're expecting that to come through to help us influence quarters 3 and 4. And our core services, support services have been updated as well. And we're in a strong position, I think, in relation to the core support services, and particularly strong working with the trade unions. Harm from reduction in non-COVID activity. So I won't say too much on this, other than this has been a real focus for the Q2 operational plan. And it's fair to say that all organisations are finding this extremely challenging in terms of how to open access to as many patients as possible, but to make sure that that is in a protected environment. Very detailed work, particularly by Jamie's directorate. And we're at this stage testing out and working through modifying the pathways and the way in which we support people to access care. And then Melanie Davis just referred to some of the partnership arena work, both in terms of mental health, in terms of Start Well for Children and in relation to the Regional Partnership Board. And really the harm from the impacts of lockdown generally in that partnership arena. Some real focus needed on children's well-being, and we've got some steps in place to support further work on that from the Startwell Partnership Group. And we will need to be looking as a board at what the short to medium term impacts are of the pandemic. And I would want to just mention Professor Mark Bellis's work, and I think we are going to give that some further consideration. So that's it from me, Chair. I'm sorry that it's in many ways such a short report. It cannot demonstrate the sheer amount of work that colleagues across the Health Board have put in, but there are many supporting papers and information underneath that should any board member wish to have a look at them. Thanks very much.
Yes, thank you, Carol. Very important points in there. If any of the independent members would like to raise their hand with a question or a comment, now is the time to do it. Any questions from anyone or comments? Well, thank you, Carol. As you say, there's just so much in there that you could have elaborated on, but time forbids it, I'm afraid, but thank you. So that takes us into agenda item 2.2, which is the Q2 operational plan. And I think, Hayley, you're going to present this as Director of Planning and Performance.
Thank you, Chair. Hope you can hear me okay. So this Q2 operational plan is here today for the board's approval. We have been undertaking work as a health board to respond to the requirements as set out by Welsh Government in its operating framework. And this draft plan was considered in the Strategy and Planning Committee on the 9th of July and has been submitted in draft form to Welsh Government. We've received some initial feedback from them about our submission, which I'll cover in a little bit of detail. The Chief Executive has just already covered the fact that we have a comprehensive plan. Our phase 2 plan has been shaped around the 4 harms, and also it sets out the Health Board's work on test, trace and protect. But in addition, we've worked really hard in our Q2 plan to reflect the circumstances that we find ourselves in Powys as both a provider of services, but also as a commissioning organisation. And we've worked very hard with our neighbouring health boards, both in England and Wales, to reflect some of the issues and challenges that we face, both as a commissioner, but also in terms of making sure that we've got a whole system and clear pathways for our patients during both COVID and also in how we respond in bringing back services routine and essential. We've, in terms of the work within the operational plan, there was some significant work done at pace, and I'd like to thank the organisation for wrapping around the essential work to ensure that we were able to produce this plan to meet the requirements. And clearly the work that the organisation has done is significant, and in particular has been done at significant pace. So there were some amendments and strengthening that we continue to do since the draft that was considered in the Strategy and Planning Committee on the 9th of July. And within that, just some highlights, in particular the extensive work that has been undertaken for us on including the demand and capacity modelling approach around our services and the assessment work that we've been undertaking to switch back on routine services, as well as making sure that during that period we were also able to see the draft plans from neighbouring health boards in Wales, and obviously we're aware of the restoration and recovery plans in England as well. So we were able to look at that content, and there was significant content to go through. So we've been able to ensure that that's reflected as best we can for the Q2 submission. In relation to the work also that Powys County Council has undertaken to look at the impact, the wider impact of COVID-19, this was being done in concert with the development of our Q2 plan. So you'll see that we've added some detail around the work that was led by Powys County Council around the wider impact of COVID-19. Clearly, the Q2 plan sets a number of challenges for us to deal with as an organisation, but I'm very pleased that we've had our formal feedback meeting with Welsh Government, and they have shared with us their initial rapid review of our plan. And there are a number of areas of good practice that they highlighted, and just building on that local authority relationship, the work in particular that the Director of Nursing, alongside Ali Bullman in the local authority, has been undertaking around robust planning for care homes, and that good social care interface and collaborative working is strong within the Q2 plan. I think that, you know, the most important asset we've got during this period is our workforce, and again we were commended in terms of the workforce plans and the approach that we've taken in this plan. And then the other areas, which I think is an important one to reference, is around the risk approach that we've taken, and they reference it as being exemplar and well presented in providing assurance, because in terms of how we're working together currently, we're having to ensure that we're responding in a planning way, in a very responsive way. We're in an operational planning phase, we're not in a strategic planning phase. Therefore, we're having to work very flexibly and very agile way to reflect the pace at which some of these services are developing. So nearly as soon as you've written a Q2 plan, things move forward and need to be continuously updated. And in that context, as a planning process, we're now currently looking at lessons learned from Q2 to try and make sure that we're embedding an approach that actually takes us through the next part of the year, particularly with a focus on winter resilience and winter planning. So there's a strong focus on that for our Q3 and Q4 plans. In terms of areas that were highlighted for further discussion with Welsh Government, I'm pleased to be able to say generally it was about providing more information and more assurance to Welsh Government about the detail that sat behind the Q2 submission. And some of those areas the Chief Executive already covered, particularly the impact of the South Powys pathways, of the opening of the Grange earlier, and the progression of how we're going to step back up the North Powys Wellbeing Programme. That was about providing additional information. It was also about providing additional information around how we were managing our collaboration with neighbouring health boards, particularly around surge planning, and we were able to reassure Welsh Government that the normal flows of activity for critical care and acute pathways for our population have already been built into our neighbouring health boards plans, both within England and Wales. And then the final point is the continuous focus that we have as a provider around how we're stepping back up routine services, and a particular focus, and I know we'll be working on this for Q3. There was a particular focus initially on those services, outpatients, diagnostics, but there's been a request to look at in a bit more detail the impact on our community services and how we manage that functional capacity and demand during particularly going into the winter period. So generally, you know, I think that we can be assured that the Q2 plan we submitted to Welsh Government met the requirements and the schedule moving forward. Sorry. Sorry. Shall I wait until we can sort that out?
Technical problem there, but
no, that's fine.
At the end anyway.
Piercing sound.
Yeah.
It was just a couple of things I wanted to say just to finish off, Chair, is that obviously we've been working alongside the Powys Community Health Council during the start of the pandemic, and we're able to now step up the more routine arrangements that we had in place during the next period. So we'll be working alongside the Community Health Council and other health boards and organisations to ensure that ongoing engagement as required is taking place on any key changes that has had to be put in place on a temporary basis, but also how we move forward with new ways of working. So that's a quick overview, Chair. I'm very happy to take any questions that people may have.
Yes, thank you, and congratulations for all the hard work that went into that. Much of it done remotely, and I found it actually in my own work that it works to work remotely and not to have to come onto the premises. Lovely document, plenty of illustrations. So Owen, I think you have your hand up with a question.
Yes, thank you, Chair. Yeah, could I just echo that? When I said it at Strategy and Planning, so I'll say it again now. I thought it was a really useful report and plenty of diagrams and maps for those of us who like those sorts of things to aid our understanding. It's just about on page 42. It's just about the Grange. It was just about. I made these comments before. I don't quite understand some of the language, particularly around the South Wales programme, but I guess given the audience, that may well be okay. Given that Welsh Government will understand that, it's just you know, if it's in the public domain, it would be helpful, but to clarify, but more importantly, because it is in the public domain, that some of the data in there I've seen for the first time, like this figure about 7.3 minutes average, and I don't actually know what that is and what it means, and I wonder if we could somehow have a bit more clarity on where that's come from. I assume it's from an Iron Bevan, but I don't know. It's not necessarily our figure. I'm just struggling to understand that bit and where it comes from. That's all. And I think I heard we're having a session about it in September, which I guess would be very very helpful. I don't know what format that would take in board development. By just would it just be execs from our organisation then? Thank you.
Thank you. Carol, you'd like to respond to that, would you?
Yes, thanks very much, Chair. Thanks, Owen, and thanks to Hayley. I'd endorse your comments, Chair, that a huge amount of work went into this, and I think it's hopefully it's quite an accessible format. In relation to the Grange, Owen, in particular, I think it was important for us to ensure that Welsh Government, so clearly they'd requested this report, were aware that this was an important and significant matter for us as a board and for our community. Clearly it changes the landscape somewhat. It sort of brings it all forward, and if we're brutally honest about this, we're still working through the detail with an Iron Bevan. There are, I think, 46 or 47 different pathways, and Iron Bevan will be helping us to understand which of those pathways are being implemented in line with the original plan and the opening in the spring, and which are not. We'll be doing the work to ensure we know how many of our population are in each of those pathways and what that actually means. There's an item a bit later, or next actually, on strategic priorities. So you will see that the South Powys programme really is about this, but also our connection with Cwmtaf Morgannwg and other key sort of stakeholders, including Wye Valley Trust, for example. So we haven't got the detail workings out yet, Owen, in reality. We're working very hard. We stood the programme board up to meet every month, and there's a lot going on in between that. And the session in September, and it's very early in September, we hope to be able to bring forward more detail about those 46, 47 pathways, and in particular the amount of provision that will be at Neville Hall Hospital, and the numbers and proportion of people who potentially have their pathways changed. So it was really key to nail that down in that Q2 response, so that government are aware that this is not just for the Aneurin Bevan resident population, but it affects the catchment population for that area.
Thank you. Claire Madston, your hand is up. Would you have a comment or a question?
I think it's Owen's hand.
I have, sorry.
Well, oh, all right. I thought Claire's hand certainly was up at one point. Sorry, yeah, you could be right, yes. Ian, do you have a question?
I think it's Owen, Chair.
Right, well, would you still want to respond to that, do you, Owen? I'm sorry.
Yeah, and thank you for the update. That's very helpful. We're working it out basically, and I can understand that it was just seeing these things for the first time. That was all. Just sorry, while I got the floor, it was just page 61, which was about community pharmacy, and it was just I wondered if we could just say something in there about that we're reviewing previous practice in community pharmacy. With a view to seeing how we can improve in the future.
If indeed we are.
Well, yes.
I would just say maybe Jamie wants to come in on this in relation to community pharmacy. We do know that we've made some additional investment in pharmacy, in particular to be supporting care homes via both our own medicines management, but via community pharmacy. So there is that further development that's been put in place, supported by a regional partnership board, ICF funding. But Jamie, did you have anything you wanted to contribute on that?
Yeah, thanks, Carol. Yeah, thanks, Owen. Yeah, I'm looking at page 61 myself now. In that regard, I think I would suggest that in all of our services at the moment, I think my comment would be that we're continually reviewing everything we've done in the past, because actually the phrase we've been hearing nationally and globally is the new normal. And actually, therefore, by default, the way we have worked and the things we've done in the past are all to be questioned, because some of those things we won't be able to do again in the future. We are keen to increase the engagement with pharmacy with our clusters as well. The cluster monies, which is led by the clusters, not directed by the health board, have made small allocations to pharmacies as well to try and help support them. I think of all of the contractors, I think it's fair to say that community pharmacy did have to keep its door open more than everything else, because actually it is a shop on a high street and was readily available to the public, actually, whereas there was far more of a triage mechanism in place for dentistry and optometry, which was primarily scaled back dramatically, and even the GP surgeries, which were all open, of course, had a front door triage mechanism to ensure that patients got support, but not necessarily physically in the buildings. So I think your question is generally that we would be continuing to work with the pharmacies going forward in line with any contract discussions nationally, but to maximise the learning from COVID, and there's been some good learning from COVID for us all, is what I would say, Owen.
So, Owen, are you seeking a sort of additional bullet point with that substance in it, or are you happy with it as it is?
No,
Since
that's
this
fine.
is something we have to approve.
No, I mean, Jamie's point is a fair one. We're always trying to learn. So yeah, it was just, I mean, Carol will know particularly that I've got a bit of a beef about community pharmacy locally, and I just wanted to try and reflect that we will somehow try to learn from the experience of the last few months in community pharmacy.
Right. Okay. Carol, your hand is up, and Hayley, I think. Is that right?
Yes, thanks very much. I wanted to take the opportunity. Francis Gerard has asked a question around the question is this: what has been the response of Powys residents affected by change in the shift of care provision? So I think the answer to that, Francis, is that we are still really trying to establish a more comprehensive picture of the response. We have had very few concerns raised around the changes. I think people have been very understanding of the need for, services to be modified. We know that fewer people have come forward into the services in the early days, at least, that that's now picking up, and so hopefully people are feeling more confident about accessing services. We had a really helpful discussion with the Community Health Council where I picked up some really strong feedback about digital access to services, so digital consultations, and a real sense that they would be really keen to see us progressing with that, which we are. Not only because it means that we can offer access during this sort of COVID experience, but also that it saves on travel time and disruption to people's lives if they can indeed engage through digital means. And I was really pleasantly surprised by that level of feedback. So it would appear that certainly from some of the soft intelligence we've got, that individual patients and residents are being really flexible and responsive to the changes. But we do need to do a specific piece just to understand that a bit more in the round.
Hayley, did you want to comment?
No, I haven't got my hand up, Chair.
Right.
Chair, Francis and
Susan. Yeah. Susan, do you want to? Oh, Francis, you'd better come in next.
Okay, no, thank you very much for that, Carol. That's very helpful. And I would concur. I suspect that the ability to offer digital consultations will make life very much easier for many rural patients where they don't see the need to come in for stuff that does not need a physical examination. So this may be one of the silver linings, one of the few. Thank you.
Thank you. Susan?
Thank you, Chair. It's a question for Jamie. Jamie, are we confident that firm plans are in place for the future winter period regarding the delivery of medication by community pharmacies to housebound and possibly those members of the community that are shielding or will be shielding possibly?
Thanks, Susan. I'm no expert on shielding, but my understanding is that it formally, at the moment as it stands, ends the second week in August. So as it stands currently with national guidance, there will be no shielded category patients as we go into the winter. Clearly, many things could change, and we would also be wanting to work very closely on that matter. For me, with regards to pharmacy and medicine supplies generally, we've been monitoring that situation very closely since March. And always do anyhow. We had nationally some challenges on pharmacy particular items well before COVID, Susan, and some of those carried on. But the mechanisms we have in place would carry on now during what is summer period and into that. And we want to work making sure we work closely with the pharmacy sector as well, particularly on that, but also wider into the flu preparation, because pharmacy, of course, is a key player in that. So our mechanisms are in place and have been throughout our COVID response, and will carry on into our phase 2 response of COVID, about monitoring particularly line-by-line items from a supply into our hospitals, of course, which is paramount, as well as into the community sector and the independent sector of pharmacists across the Powys area.
Yes, thank you. I suppose really what I'm asking is that will the community pharmacists, given their extra workload, be able to also deliver medication, if we do have that second surge and some people will have to again shield, is there that link? Because I think some of the volunteer services are going to have to stand down.
Yeah, and I don't believe that is the case, Susan. So if we got to the whole point of our response plan would be that what worked well during COVID, and I think the CSERT service and the community volunteers was a particularly silver lining to the COVID challenges that we faced, and we'd want to build on that throughout Powys. So we'd want to do more of the same and more as we can, as we get more clarity on what a wave 2 can look like and what those particular challenges are. But we'd want to build on that. If we end up having to recommend shielding again to patients, we would want all of that response plus more where we can in place. And I think linking with the pharmacy and the GP practice, because of course a lot of our practices dispense, Susan, as you well know, for deliveries was a key silver lining to some of the challenges we faced in COVID, and we'd want to carry on doing that during the next phase and wave as dictated and as our population requires.
Thank you, Jamie.
Okay, Katie, guest at our table, a virtual table, I should say, in the boardroom, or not. You have a question or comment?
I'd just like to make a comment, Chair, if that's all right, please. Going back to the digitalisation, Carol's absolutely right. The CHC is happy to embrace any new innovation. I think there's just a sort of slight caveat there in that, given that we are all currently working via the digital platforms, the only views that we are really currently seeking at the moment are those through digital platforms, through surveys and things. So we're actually looking at undertaking a piece of work which actually tries to broaden that sort of response rate from people who are perhaps not so digitally connected. And obviously that's quite an issue in Powys, given the connectivity, given the demographics. So just to provide you with that assurance that there's a lot of positive feedback, but it is from those predominantly who are already engaged digitally. So you would expect that.
Yeah, that's a good point. Thank you. Are there any other comments before I ask you to approve this? No? Can you then indicate that you approve the Q2 operational plan? Good, everyone? Thank you. That's fine, thank you. So we can move then on to the reprioritize strategic objectives. And I don't know, Carol, who's taking this? It's Hayley again, is it?
You're on mute, Carol.
I'm mute.
Carol.
Dear me. 5 out of 10 only. Okay, yes, I am going to take this, Chair, and colleagues may well join the discussion. It's really important that I say at the outset that it has been a really extremely busy period. It's always busy in the NHS, but particularly so since March. Board members will recall that we had signed off our annual plan in January, had submitted our IMTP into Welsh Government. But by March and then May, we were clear that we were going to have to modify the plan to a significant level. We agreed as well that we would keep the revised annual plan under review and review it formally every 90 days. Well, at this stage, we're at about day 60, following on from the May decision that we agreed the revised annual plan. So a little bit shorter than that, but given that we're already clear that we are planning and needing to plan for a very challenging winter, we've had to take a review of some of the key strategic priorities that remain for us over the next 6 months. This in particular is to help to ensure that we can, certainly as an executive team and hopefully as a whole board, see the wood for the trees during this next period, and quite honestly to manage expectations about what we really can achieve and what will be challenging. The first thing that I should say in relation to that is that the strategic priorities that are presented here are very challenging to meet, let alone everything else that we'd actually had to prioritise in a different level of order, that if we were adding those in as well, it would be nigh on impossible to achieve. So the sense of needing to be much clearer about our core strategic priorities felt very important at this stage of the year, given what the environment looks like as we move into the last 6 months. We will clearly need to keep this approach quite flexible and be realistic if the very challenging winter which we will plan for does in fact materialise. So important for me to say that. Just in terms of the strategic priorities themselves, there are 12 plus 1 that I say that might be because maybe I'm feeling a bit superstitious about 13 baker's dozen, but there are 12 core ones, and there is a partnership one which we have identified here. So you'll see that on page 4 and into page 5 of this report, or 19 and 20 of the bundle, we sought to identify the priority area, the rationale for why it is a priority, and the deliverable. The key element is that there could of course be many more things that we put in, but the reality of the situation is that if we don't do these elements that are within the plan, things will happen to us. So we need to be in control of that, either in the short term or actually in the medium term. So hopefully the paper is reasonably self-explanatory. And I won't give any more detail at this stage, but look to take questions on it. Thanks very much, Chair.
Thank you. Has everyone had the opportunity to read this carefully? Good, thank you. Shall I just take Trish first then? You have a question, Trish?
I think it's more of a comment. I find this document really helpful in terms of rationalising and reprioritising what we're doing. You will see I had asked a question under the corporate risk register as to how we were actually going to manage on all fronts, and this is, in many respects, goes forward to helping my understanding of how we're going to manage the capacity and capabilities of our staff and our directors at this point in time, because clearly we can't have business as usual, and I found this really helpful. Thank you.
Thanks. Thank you, Trish.
Francis, did you have a question? No. Sorry, Mark then.
Thank you, Chair. Just a point of clarity and perhaps an additional question. In terms of the Bro-Dyfi and the rest of the capital programme, how is that reflected in these? Because obviously we had the recent report to Performance and Resources, and we did prioritise the Health and Care Academy, but I didn't expect that would be at potentially the cost to the other projects such as Bro-Dyfi. So perhaps you could clarify that.
Yeah, I can indeed, Mark. So you'll see within the paper, it's got the North Powys programme. So what we have been clear about with the North Powys programme, and I recognise a lot of the focus has been around trying to get a business case that will enable a capital development in Newtown. But the question is excellent because it gives me an opportunity to remind us all that the North Powys programme is about the whole of North Powys. And critically, the Bro-Dyfi development does feel really key and is a part of that. So much work had happened, and actually we had an innovative environment group last week. We were able to discuss the need to push on with that, and the work that actually has been happening while even through the pandemic. So if it's not mentioned specifically there, Mark, it is part of that wider development. I don't know if Hayley, you'd like to make a comment on that.
Yeah, so just to reassure the board, this continues to be a priority, and we're in the process of finalising with our new partner, Wilmot Dixon, the tendered costing so that we can resubmit the full business case in the autumn. So that is progressing well, and we'll be coming coming back for due consideration and approval to committee and board in the autumn.
Thank you very much.
Does anybody else have a comment or a question? No? Well, it was essential that this should be done, and again, I'd like to express my gratitude as chair of the board to the exec team for working so hard to produce this in such a short time. Can I ask you then to approve this this document outlining the reprioritised strategic objectives? Yes, everyone approve? Thank you. Now, podiatry service engagement. I think possibly our colleagues on the Community Health Council might have something to ask about this. Can I ask Claire Marsden to come in, please?
Hi, thank you, Claire. So this is an update paper. The board are already familiar with this paper, I know. And it just introduces the feedback that we've had on the podiatry paper and asks for approval of the implementation of the new model of the clinical service. So the paper includes the CHC feedback that we've had and lays out that the CHC are in agreement with the option 3. We've highlighted in there the mitigations that we would, of course, be putting in place based on those comments that we've had. It's probably worth noting that the podiatry service is currently in being adapted anyway in light of COVID and how we open everything back up again. We've had some written questions which I've provided feedback on, and I think those are all available now in writing, will be published at the end of this meeting. I'm just asking really for the board to approve this paper now. There was I think I had a question from Francis Gerard about podiatry. I'm sorry I didn't get back on that one. And that was a question asking about whether we'll be doing digital podiatry going forward. And I just wanted to assure the board that we have been looking into digital podiatry. Some of the team have already been trained in Attend Anywhere, which is the format that we plan to use for podiatry. We certainly think we can look at musculoskeletal podiatry patients virtually. We're not sure if the resolution of the cameras is good enough yet to actually look at wounds virtually, but we will certainly look into that as well. So just to reassure you, that is part of our plan in delivering services going forward.
Thank you. Are there any comments or questions?
Chair.
Yeah. Francis?
Yes, Chair,
yes,
can you hear me? Thank you. Oh, sorry.
Right, okay. Sorry, which Francis?
Oh, I'm sorry, Francis Gerard. I'm sorry, of course, we have two Francis. Quite an unusual name too, so.
Vintage.
You're not unique.
Yeah.
Francis Gerard.
Okay, Claire, thank you very much for that. Yes, and I'd agree. I think I phrased in my question that there were limitations, but undoubtedly services, and you'll know this better than me, such as physiotherapy, have advanced considerably on this. And I was just thinking it would be an efficient way of helping a small proportion of our podiatry patients.
Yeah. A few of our staff are already trained and are trialling it now, so it's going ahead.
Oh, great. That's excellent. Thank you. Well, Francis Hunt, did you have a question?
I had a comment, Chair, if I may.
Yes, of course.
The Executive Committee of the Community Health Council did consider this matter electronically and sent in its written response to the Health Board on the 29th of June. Members generally agreed that the consultation had been adequate in relation to the content and the time allowed. They noted the number of responses was quite disappointing, but also acknowledged that the Health Board had allowed additional time. And we weren't sure how much more could have been done with the restrictions that were imposed by COVID-19 in place and which were in place post-March 2020. Members wish particularly to record a number of observations. These included access issues, particularly in relation to our old friend parking, which was likely to be a problem. It's already very tight in Newtown and Welshpool Clinic, so we noted that. And there were some various and very serious concerns expressed regarding transport issues. And these were especially transport issues for people going to clinic from outlying rural areas, and included access via community transport and public transport as well. Finally, I can confirm that option 3 was unanimously agreed, subject to a number of additions to the mitigation plan and a monthly update on progress being provided by the Health Board to the Executive Committee. Thank you, Chair.
Oh, thank you, Frances. Claire, did you want to say anything more?
No, I think we've agreed to all those mitigations and addressed that. Thank you.
Oh, that's great. It's a very, very comprehensive document and very informative. I've never learned so much about podiatry in my life. Fantastic. Thank you, Claire. Really good. Are we all content to approve? Yes, thank you very much.
Thank you.
Right, and in very good time, I'm inviting the Board Secretary, Ronnie, to comment on or give us some information to note and approve on our standing orders. Ronnie?
Thanks, Chair. This paper proposes some amendments to our standing orders that we're required to make on the instruction of Welsh Government via a Welsh Health Circular. The changes proposed are in relation to a temporary suspension of public appointments, allowing during the period between July and March 2021 to allow public appointments to be made to health boards for longer than the usual 8-year period, potentially up to 10 years, to support the public bodies unit with recruitment of public appointments during this period where there has been a suspension. And then also to amend standing orders temporarily to allow for 2020 the annual general meeting to be held by the end of November and not September as we usually would. And then the third part is that our joint committee standing orders, or Welsh Health Specialised Services Committee and Emergency Ambulance Services Committee standing orders would need to be amended in the same way. So the board is asked to approve those amendments as set out.
First of all, are there any questions? I don't think we have much option here. I think we have to approve these. Everyone in agreement? Thank you.
Thanks, Chair.
So the board and committee work plans.
Thank you. So this paper presents to the board the work plan and schedule of meetings for the board and its committees for the remainder of 2020-21. The business set is aligned to the priorities agreed by the board a couple of items ago, we agreed, the board agreed in May that the committees during this period would have shorter, concise agendas focused on essential matters. So the work plans have been developed with that in mind. I won't go through each in detail, but I'm happy to take any questions.
Does anyone have a question? No? Well, thank you. I take it we approve.
Sorry, Chair. My apologies, Chair. I didn't see the button with my hand quickly enough. Okay. I just wanted to address a couple of the questions that have been forwarded by Ian Phillips, particularly a question around workforce, digital and innovative environments being important for transforming care for the winter period. Hopefully, Ian, you will have been able to see from the Q2 plan the aspects of workforce, digital and environment have come through that. I'm reasonably clear that those issues will continue to feature through quarters 3 and 4 for the rest of the year. And clearly, in terms of the strategic priorities paper we've just signed off, they were within those areas. These are key enablers, of course, in our health and care strategy, so they were already a big focus. It's just with COVID, it's given us an opportunity to really focus down on the things in the COVID environment. So hopefully that's helpful, and we will be covering those elements through the board's business. The digital plan, as you will know, was in the paper on strategic priorities, and we will be tracking that through and the progress on that. I think Claire just mentioned Attend Anywhere, for example. I'm very keen that we can keep track of the uptake of that and see how many of our patients are accessing care using digital means, notwithstanding the very valid comments that were made earlier by Katie from the CHC. And then on Workforce Futures, clearly this is also a partnership endeavour. So we discussed earlier in the week at the Regional Partnership Board the reporting through of some of the Workforce Futures key priorities. And again, that coming through, particularly around the Health and Care Academy, the first stage of that will come through. It'll also be picked up through our work at places like Innovative Environments, Digital and Executive Committee. Thanks for the questions, Ian. They're helpful.
Okay, are you happy with that, Ian?
Yeah, that's a really helpful explanation, Carol. I was just trying to make the links between your earlier paper in terms of revised strategic priorities and the programmes, and it wasn't necessarily explicit within the individual subcommittee work programmes. And I also thought really around the digital in particular being part of the I can't remember what you call the dozen priorities. I can't remember how you described those earlier. Whether indeed we are covering that from an ongoing point of view in the subcommittee work, but whether it needed to be considered a strategic issue as well, and the strategy and planning haven't had the opportunity to input into that. I know that as Hayley mentioned earlier, we're in operational planning mode, and I get that, and I've got no problems with the digital plan as it stands, but wanted to know how we get to influence the strategic elements of that as we move forward.
If I may just respond, I think it's really interesting, Ian, because I've heard an awful lot of comments from people in the world of digital and saying this has been the silver lining for them on the COVID cloud, is that the things that people really wanted to get done have actually happened more quickly during this environment. Needs must and all of that. So I think, as we get towards the end of this financial year, we'll need to take stock of actually the distance travelled, what that means for the next couple of years and where we're heading. So I think it's a really important point to say sort of we are sort of in the short term largely, but we will eventually be able to get our head back up and think about the medium term in relation to digital. And hopefully we will have changed the whole landscape for digital care and support. So yeah, thanks for that.
Thank you. Any more comments? Well, can we approve the board and committee work plans then? Good. Thank you very much. Nearly at our break time, a little earlier than anticipated. So board development plan, a refresh on last year's plan. So who wants to take that?
Thanks, Chair. I'll take that if it's okay. The board agreed its board development plan in July last year, a 2-year plan. This paper provides the board with an update a year on. It includes within its appendices an update on the progress we made during 2019-20, and actually where additional priorities were identified throughout the year. And it proposes the actions that we will take around our development and the knowledge and update for the board through thematic sessions during the remainder of 2021. So happy to take questions and would ask the board to approve that.
Thank you. Another very welcome document, actually. Thank you. Any questions, comments? No, I can see you're all ready for your coffee. But thank you again, Rani. Is everyone happy to approve then the board development plan for 2021? Thank you very much. We have a break now. Right, welcome back, everybody. Thank you for joining us again for the second part of today's board meeting. We need to press on then with section 3 and begin with exiting the European Union, which could, I think, be a 2-day meeting if we had the time for it. Is Stuart available to take us through that?
Yes,
Thank
Chair.
you.
Can you hear me okay?
Yes, that's fine. Thank you, Stuart.
Okay, thank you. So this is a discussion paper, an EU transition briefing paper to provide an update to board members really on the latest situation midway through the transition period. Obviously following the UK's exit from the EU at the start of this year. And just to give a sense of, I suppose, a temperature check really of where things are at the current point in time ahead of 31st of December 2020. Just in terms of background, I did look back at the board agendas for past meetings, and colleagues will remember that there was a fairly regular cycle of update papers coming to board really up until the turn of this year. So there is a paper trail of board briefing papers and updates that have come through, and you'll see from the work plan for board going forwards in the previous item that we've now scheduled again update papers going forwards to ensure that the board are kept up to speed in terms of where we're heading from a planning point of view for EU transition. So the last update board was towards the end of 2019. At the beginning of January 2020, arrangements from a planning point of view across Wales were temporarily stood down, and that was following ratification of the withdrawal agreement. And it was always the position at a national level that was a temporary cessation, and that an assessment would be undertaken midway through 2020 of what the position looked like in terms of future arrangements between the UK and the EU. There was a briefing paper produced by Welsh Government colleagues earlier on this month, actually, which does set out a temperature check, really, of where Welsh Government see the position in relation to negotiations with the EU, particularly thinking beyond the end of this year into January of next year. I think it's fair to say that the summary from that assessment is that there is a view that the comprehensive free trade agreement that is obviously the aim of the negotiations that are taking place at the moment, a certain degree of I suppose pessimism currently about the state of those negotiations, and the potential that towards the end of the year into next year we do potentially end up in a situation where we're on World Trade Organization terms. So negotiations are obviously continuing, but I think the assessment currently is that the degree of assurance about agreements and arrangements being in place by the end of the year is probably limited assurance from a national point of view at the moment. In terms of what the issues are that we're beginning to think about, they are not too dissimilar from the issues that we were considering up until the end of 2019. So the conversations around medicines, securing supply of medicines post EU transition, medical devices, clinical consumables, particularly locally where we have essential medical devices that are non-stock. We did quite a lot of work in 2019 going through those lists and making sure that we had buffer stocks available of those items should they be needed. So that work is essentially going to have to be refreshed and reviewed again. The third area is obviously around workforce, particularly in terms of EU nationals, retention of workforce, information and advice about immigration and essentially retention of EU workforce going forwards post 2020. And then the other area that I think we're all reflecting on a little bit at the moment is some of the more longer term conversations around the social and potential economic planning around the longer term impacts of withdrawal from the EU. I have to say I think some of that is getting wound up now in conversations about COVID-19 and about some of the impact of COVID-19 as we go forward as well. So there is beginning to be a similarity in terms of some of the longer term conversations, both in terms of the impact of COVID-19 and coronavirus on broader elements of society, but also particularly in terms of EU transition as well. So that's an area that we were beginning to get into up until the end of 2019. We were doing work around support for the farming community, particularly given the vulnerability of the farming sector in relation to any withdrawal from the EU. So broadly, the issues that we were looking at in 2019 are broadly going to be the issues that we're going to have to get back into in the second half of 2020. From a governance perspective, just a quick note on that. So, as I mentioned at the start, effectively governance planning arrangements on a national level were temporarily stood down at the turn of the year. There is now at a Welsh Government level the standing up of a leadership group, and I think that met for the first time in July. Looking at the communication coming out from that, the plan is to step up local planning arrangements to support the national tier from September. So there were a whole series of planning groups and governance groups that were in play in 2019. I think broadly that model will continue now into the second half of 2020. So we're effectively working on an assumption that we will be standing up locally support into that national arrangement from probably early autumn. More locally, I've asked through our civil contingencies and business continuity routes, I've begun to ask that we look at the planning that we've done up until the end of 2019, just to check that planning and those assumptions are broadly still extant and nothing major has changed. But then with a view from August onwards to begin again that process of an internal group to plan our own local planning arrangements ahead of the end of the year, so that we can then both react to any national requests around frameworks, but also so we're clear ourselves what our areas of work and areas of priority are. I do put just at the end of the paper, and I will flag it, that it is obviously a subtly different environment within which we're working this year to last year, by which I mean we're also obviously responding to coronavirus and COVID-19 actively as well. There are some pros and cons to that. I think it's been reflected nationally and locally that some of the testing of supply chains, understanding the complexities of those sorts of arrangements, I think responding to COVID has helped in terms of us understanding how to maintain robust supply chains. But there is no doubt that in terms of added complexity, managing both a live response to a pandemic as well as planning for the end of the withdrawal period from the EU, does put a layer of complexity to arrangements, both nationally and locally, that we're going to have to work with and manage as we go forward. So there is some shared learning, there is some added complexity, and we're going to have to work our way through that as we go through the rest of the year. So broadly at the moment, we're checking, reviewing that the work we were doing up until the start of this year is still extant. We're effectively then restarting those processes into beginning of August, so that we're ready when the national arrangements begin to kick in from September onwards for the remainder of the year.
Thank you, Stuart. I think probably the most challenging scenario to most people would be a spike in the COVID virus, and at the same time exiting a hard exit from the EU. Very, very difficult for everybody. I can see Owen has his hand up. Owen, and Trish, then Trish.
Yeah, thank you, Chair. Thank you, Stuart, particularly for the report. It's really helpful, and thank you for the opportunity to discuss it with you as well. I think I said to you separately, I think I don't have any answers. I don't even know what the questions are, but I think it's sort of quite important that we're still looking at this and we're trying our best to prepare for it. Because my main additional point to what you said in the report is about preparedness. Regardless of your views or regardless of the outcome, it's the preparedness or inability to prepare because we don't know the outcome that is the biggest issue. So it's just important I thought to emphasize that. Maybe that doesn't apply quite so much to workforce, in that we know what the immigration regime is likely to be. Whether that makes it easier or not to predict the outcomes, I'm not sure, but at least we know what that kind of regime is likely to be, and I'm not sure that the outcomes are necessarily good for the health board or for Powys in general. I just wondered if I think you mentioned at the end of the report about where it was going to, that it was going to keep reporting back. Where would that come back to, was the only question I had, please.
Yes, so just to clarify that, Owen, it was just to reiterate the point from the previous item on the work schedule for board, that we have got going forward board dates where we will effectively, as we did last year, Owen, we will bring I will bring essentially to each board meeting just an update paper on progress locally in terms of planning and response arrangements for COVID. So it was just to reiterate those dates that have been agreed, that we will look to bring formal written briefings back to keep board members informed with work as we go forward. I think your earlier point is a really good point. I think as I sit here, I'm relatively comfortable that the immediate issues around things like medicines, medical devices, clinical consumables, the very sort of hard short-term issues, particularly turn of the year, we can kind of, that very short-term impact of shortages of supply, we kind of have been there, we've kind of planned for that. There is the tension of, we've also had to prepare for COVID, stocks that we've used for COVID, space that we've used for COVID. Where is that now in terms of providing buffer for potentially the impact of interruption to supply due to EU exiting? The area then rolling forwards, I think, into 2020 and beyond is the more structural impact of something like EU transition and how we respond to that. So I feel that there is a strategic response as we roll forward that we will have to give more thought to probably as a whole organisation really, and probably across Wales, about some of those more fundamental impacts that I think you're absolutely right, we can't necessarily predict right now, but it feels are going to be the ones over the next year, 2 years, 3 years, potentially longer term, that we might need to think about. And some of that, my own view is some of that is about the partnership arena as well, PSB, those sorts of arenas. How are we going to grapple with things like EU transition through partnership arrangements as well, because they're big issues that we need a partnership response to, I think.
Thank you.
Thank you.
Trish, you are next, and then Julie.
Okay, thank you. I think you've possibly dealt with a bit in terms of my question really is that during the pandemic we were drawing on supplies, medical, particularly clinical consumables, and it was widely talked about them being also dipping into the Brexit supply. I just want to know that we're aware of it and that we're starting to build up stocks so that we can support any issue around leaving the EU, and also that we can supply for the needs of any surge in pandemic activity.
Yeah, thank you, Trish. I mean, some of this is national supply chain conversation, which the current position I can't claim to be completely cited on, but I can tell you that there is an acute awareness that probably not just EU stocks, but I think national flu stocks have been used in some instances around PPE. I think there is a recognition nationally, as there is locally, that going into the winter, in terms of resurgence of COVID and potential EU impacts of interruption of supply, do need to be taken into consideration as we plan for things like PPE and those routine medical devices. I can't give you a detailed response, Trish, at the moment in terms of assurance from a supply chain point of view, but I do know, because I've read the papers, that it is something that they absolutely recognise as an issue around continuity of those items as we go forward, both from a COVID point of view, but also from a potential interruption to supply from an EU withdrawal point of view.
Okay, thank you.
Thank you, Stuart. Julie.
Yes, Chair. Actually, just coming back on that point, Trish, as well, just to remind the board that we have maintained our central store on the Broncleys and Newtown sites in relation to ensuring our preparedness for COVID. So if anything, we probably are better prepared than we ever have been. And I think that's an important note. And we've identified that needs to continue for at least the next 12 months. It was just to come back and reassure around workforce, Owen, and just to refresh memories. We had identified those staff that might need our support. We'll obviously ensure that we provide that support and enable anybody who needs our support to get settled status. So that work, as Stuart says, will be picked up, but we will focus on that now moving forward.
Thank you. All content that we've been properly briefed, and we will await the next instalment. As I see from your report, you will fully engage and keep us updated. Thank you, Stuart. The next item then is the performance overview report for quarter 4 of 2019 to 20, and I think Hayley, again, is this you?
Yes, thank you, Chair. Obviously, during the pandemic, this paper provides the latest available performance overview, which was also discussed at the Performance and Resources Committee on the 30th of June. Just wanted to remind members that during this period, there's been a very different approach around performance monitoring in place, and the official sort of performance arrangements were suspended at the end of quarter 3. So part of the progress that we made was that, firstly, the issues within the paper around the national position around the availability of information, because clearly we track our patients across the whole of their pathways. There was a time period where we didn't have access to some of this information, and I know that I think it was Francis, who raised in a question beforehand regarding the impact of not having some of this information temporarily suspended. I just wanted to reassure the board that although this period of time we didn't have that information, now the NWIS processes that we use to track and understand the totality of our patient pathways are now up and running and functionally sort of in place. place, and this has allowed us to start pulling together the recent position across our whole pathways for both English and Welsh providers. So in the next report, Chair, that detail will be included. In terms of the COVID-19 response, there was quite a lot of work for us to do in terms of the performance reporting and function to support the overall management of our response aligned to our clinical response model. And part of our work was during those months ensuring that there was a daily ability to track our performance across key measures, and the report outlines some of that approach that we put in place. During this time then, in terms of this report, we have put together the latest information as provided services across the key domains. And I'm not planning Chair, to go through all of the detail, but perhaps just to highlight a couple of areas which were raised during the questions that independent members posed before the meeting. So in terms of the key issue I wanted to raise around provided services is obviously we're still now in a position where we've been able to maintain that performance reporting, and by exception, I know that I think it was Francis or Trish raised the question around, in particular, the progress around safe and effective care, and the reporting through to the Experience Quality Committee, some reassurance around the improvement expected in these areas. So I don't know, Alison, as Director of Nursing and Midwifery, whether you wanted to comment around the safe care position.
Thank you very much indeed. Yes, good morning everybody, and thanks to independent members for raising such pertinent points. I have provided a written response to the questions asked, and I guess the headlines from that, yes, to confirm there'll be a detailed discussion in the Quality Experience Committee on the 30th of July. In terms of improvement, the range of improvement activities have actually been undertaken. I think in relation to infection prevention control in particular, as our IM champion will be aware, there's been quite a refresh of our approach to infection prevention and control, and I'm sure there'll be an awareness at board and more widely around the key challenge for infection prevention and control during the pandemic, and some of the All Wales learning as a result from that. That certainly will be a focus into the future. For us here in Powys, we've refreshed our approach to our IPC strategic overview and our subgroups feeding into that. Plus, we've been able to secure some permanent resource to enhance that function. So I'm expecting a step up in terms of assurance and improvement there. I think a caveat in terms of the data, we are talking about quite small numbers in Powys, and therefore where we've got a red rate, if we move from a 0 to a 1, then that's 100% increase. So there's just a little caveat there as a disproportionate reflection, I think, in terms of red rating, although that's the format we've got in. In terms of serious incidents and management of concerns, IMs have raised questions there in terms of improvement trajectory also. We certainly, as you know, as an organisation, totally committed to responding in a qualitative and timely fashion. And we've got our clinical quality plan to help support that work. There's a caveat there also in terms of potential resurgence around COVID-19 during the autumn and winter, which may stymie us slightly, hopefully not. That's certainly something that's happened. We couldn't sustain progress maintained earlier this year in both those arenas because of the change of focus. However, I'm fairly confident the plans we've got in place as supportive mechanisms to work alongside clinical teams to enable us to address both serious incidents and concerns in a more timely fashion.
Thank you, Alison. In terms of timely care, then, clearly significant work has been undertaken to try and sustain services during the last period, and in particular there's content in the report around the use of digital ways of working to continue to be able to see patients, and also the particular work that's been undertaken around mental health performance, which has remained robust during Q4. I don't know, Jamie, there was a question that was raised beforehand around our plans to bring online diagnostics services. I know some of that content was within our Q2 plan, which we've just approved, but whether you would like to add any detail around particularly the timelines of bringing back some of those services online.
Yeah, thanks, Hayley, and again, Ian, thanks for that question in advance. You picked up particularly on diagnostic services. I think we've mentioned already a number of times in earlier conversations around the challenge now in reintroducing levels of activity. We will continue to face challenges with regard to social distancing. And I think I would state that the safety and confidence of our staff and our patients is paramount throughout all of this. People are returning to our hospitals with an expectation that we are visibly showing them a safe environment, and we are actively doing that on every single basis that we interact with patients. We're also very keen, mind you, to maximise the opportunity for patients to experience the virtual support. Attend Anywhere was a product that's been mentioned, that's been rolled out within practices, GP practices across Wales, but now across our services. That takes a short time to introduce, but the teams are very active and very keen to do that, because we feel it is an increased offer to patients to provide assurance quickly, bearing in mind those limitations of social distancing. I would refer Ian and colleagues to the detailed response I've given to the particular question on diagnostic services, but similarly we're working actively on timelines for all of our outpatients, and also we'll be looking towards things like day case surgery going forward in the coming weeks as well. So the month of August is a staged process of turning services back on once I and my colleagues are assured of the robust processes in place. And we can start returning to levels of activity that we would want to see, whilst we try and maximise the potential of an alternative offer via Attend Anywhere.
Thank you, Jamie. And in terms of commission planned care, I've already mentioned we're now able to pull together that information, and obviously the key issue, and the Chief Executive has already raised this in her report earlier, where there is increasing concern about the level of backlog that's actually now in place across all services, across the entire NHS, and the plans that we're putting in place. We will bring a definitive report on that once we're able to make that assessment with the latest available information. And in those discussions, there are a lot of regional solutions potentially that will be looked at, as well as locally based conversations that we need to have. So we will bring that to the next Performance and Resources Committee chair. And the final, not the most important one, is our workforce. Julie, I don't know whether you wanted to make any comments about our performance position around our staff and resources.
I think we have already discussed, understandably, we saw a dip in our PADR rates. However, we have plans in place to get those back online, but understandable as a number of staff are redeployed across the organisation. All in all, I think our sickness rates have remained pretty steady, and we've seen nothing like the spike we anticipated. And pleasing to see that we have seen our statutory mandatory training maintain its performance throughout the period, particularly in terms of making sure people were skilled and updated in relation to the roles they were undertaking.
Thank you. So for the board, this is an interim performance overview of Q4, and we'll be returning more to our normal arrangements around performance reporting moving forward. But I hope it gives a clear overview of our position, and happy to answer any questions you may have.
Thank you, Hayley. Thank you. Useful report. Are there any questions? Trish.
Mine is more of a comment, just to acknowledge the work that has been done by our Director of Nursing in helping to take forward the infection prevention agenda. It's greatly appreciated, and a lot of hard work's gone on across the organisation to take that forward. So much appreciated.
Yeah, well done, Alison. Any other comment or question? No? Thank you, Hayley. Thank you very much. So now we turn to the important matter of finance, financial performance report, month 3. Sam.
Hi, thank you all. So you should have in your packs the standard financial performance report, which has been circulated. Yeah. I'm not going to go through every slide, but there are a few items I'd just like to highlight to the board. So firstly, it's just to give you a summary of where we are from a revenue position. We are currently £156,000 overspent. I do need to flag, and I will come back to it, that this is assuming that Welsh Government fund all costs relating to COVID-19. At the moment, our capital resource limit is 1.9 million, and we have spent a little over 300,000. We are red at the moment on our Pspp target. So this target is about making sure we pay all our invoices within 30 days for non-NHS, and that has slipped in the first quarter. We are currently investigating what is driving that and trying to get it back on track. Our savings plans, so we had a target at the start of the year of 5.6 million, and we did have some plans to look to try and achieve that in full. Obviously, COVID has had a significant impact on our abilities to deliver that. My latest assessment is we were probably likely to be more in the region of about 1.8, but that continues to be looked at on a month-by-month basis as we go through this COVID pandemic. And then we get on to the COVID revenue position. So as it currently stands, which is the position at the end of June, we were looking at having expenditure linked to COVID for revenue of 20.3 million. Now, some of that is driven by our plans for surge on our TTP, and which will also link with our Q2 plan that we've submitted and gone through today. There are other issues in there about the block arrangements that we currently have with all our providers. So this is prescribed to us by Welsh Government and the Department of Health. That is costing us just under 3 million if that arrangement holds for the remainder of this financial year, and that is still to be debated. And the reason it is a pressure is because we are paying slightly more than we would have had in our IMTP plans because of the basis on which the cash payments have to be made. And then obviously, as I've already said, we are also seeing a pressure because we are not delivering the savings linked to the 5.6 million that we had at the start of the year. So all that combined, we are estimating it could be as high as 20.3 million. And then there's the capital position. So in mid-July, we were asked to submit an updated plan on the capital requirements for COVID. That came to a 1.9 million pounds. That's not to be confused with the current capital resource limit, which is also 1.9 million. We haven't yet had confirmation that that 1.9 million to support the COVID required investment will be forthcoming to us. And there are still some work to be done on finalising that figure. At the time of the submission going in, we were still unclear on the full cost for ventilation, but we should be clearer this week as the tenders are received in. And then going back from a risk perspective to this organisation, the most significant one that I do have to flag is the risk of Welsh Government not funding the revenue required to support COVID. So as at the end of June, Welsh Government had given me 0.7 million of the 20.3 we require, and the remainder is still outstanding. So I am currently reporting a balanced position, but predicated on the fact that Welsh Government will fund COVID-19. So therefore, I'm asking obviously the board to note the position that we're standing at month 3, to note the ongoing work that we are required to do to understand where we are on our savings, and also to note and approve the COVID forecast for both revenue and capital. But I'm happy to take any questions. Thank you.
Oh, well, thank you, Sam. That's quite alarming, that last item. Ian, you have a question.
Sorry, just unmuting my mic there, Chair. Yes, thanks for that, Sam. It is quite alarming, the last bit. And I just wondered whether there was any comment in relation to what would be a major gap there, and the announcement that I think I caught on the television some time ago that Welsh Government were going to write off some of the historic debts, because there seems to be a bit of a mismatch in approach there from Welsh Government.
So the historic debt, okay, we are not carrying any historic debt. So that announcement that came out, whether it was last week or the week before, has no impact on Powys, unfortunately.
Yeah, I think that was my point, really.
Yes. And even Boris Johnson made some announcements last week on funding for Welsh Government and the Scottish governments for COVID. Unfortunately, some of that was already assumed by Welsh Government as well. So there is still a gap in our funding position at the moment.
Okay, Carol, you are next, and then Tony.
Yes, thanks very much, and thank you, Sam, for the presentation. I think Sam has explained it very clearly that this is a significant risk for the Health Board, and hence in the strategic priorities paper we considered earlier, the issue of money and in brackets value are particularly important in how we may proceed in managing through this year. My understanding is that in that 20 million, about 7 million are fixed costs and 12 million are variable costs in the region of that. And therefore, if we have a better than anticipated winter on the one hand, we may not need to expend money, particularly around surge capacity and then the expansion of the TTP programme. If we don't have a good winter, we may well need to expend that and potentially more. So we will be revising these totals and considering that in terms of Q3 and 4 planning. I think Sam's also highlighted that there's quite a bit of concern in relation to Welsh Government funding, both going into the government, but also within the government going to the NHS. A lot of work has been undertaken by government colleagues looking at the expenditure in England and Scotland. And at the headline level, at least, it looks as though Wales is at least in line, if not it has spent a little less in terms of the NHS response to date. So, just anticipating that there may be a question about, are we spending more than we need to? So a real focus on being prudent, but also on planning what might come forward. I'm reasonably confident that if the Welsh Government can support these costs, that we have the detail and we have the robust information that sits behind it, and we'll be able to put forward a good case for full funding. We will need to come back to this, Chair, I think in the autumn, as things progress, to see what level of risk we are holding financially.
Thank you, Carol. And I think we should be congratulated on the prudent way in which we approached COVID. So financially, I mean, as well as in other respects. Yeah. Right, Tony, you have a question. Tony, would you like to come in? Have you got your mic switched on, Tony? Shall we go to Owen then?
No, it's okay.
Okay.
I'm okay now. Could you give some indication? It's partly what Carol said, but the the substantial increases that have gone into the English Health Service, obviously the consequential that comes to Wales is about 6% of that, but there's no obligation whatsoever on Cardiff allocating the entire 6% of those increases. They could allocate part of it to highways, to education, and so on and so forth. Have we had any indication that the consequential is virtually in its entirety coming to the health service in Wales, because that is why we're having the additional money, albeit they do have the freedom to via that to any service they wish?
Yes, so part of the funding for COVID won't directly come to NHS finance. It will go, as Tony said, to various other areas of Welsh Government. We have no confirmation on what the quantum is that Welsh Government are holding to support the NHS. We are just to give you an update. We're also being regularly assessed by Welsh Government. I actually have a peer review being undertaken of our financial position tomorrow with Welsh Government for them to start to really interrogate and understand our positions, which they will then, I'm assuming, pull together to compare to the budgets that they may or may not have centrally. But there is still some policy decisions that is yet to be finalised, which could impact on some of the numbers as well, Tony. But at the moment, I have nothing to confirm any financial position for us.
Okay, thanks for the response.
Oh, thank you. I don't think we can take much heart from this conversation. Owen, you are next.
Yeah, thank you. Thanks for the report, Sam. Just a quickie on the Pspp target, which obviously in a time of recession is going to be quite important. I think from memory, we we used to not do very well, and then we kind of burst through the target and stayed there for quite a while. You say we don't really have any idea why?
Sorry, I do. Sorry, Tony, I do have a little bit of an idea. We think it's related primarily to our agency invoicing. And we are now working quite closely with other colleagues in the Health Board to resolve it. There is also some digital solutions which I joined a meeting on this week, which may actually help us significantly to address what is quite high volume areas. So we have an idea, and we're just trying to look for solutions to help support that.
Okay, thank you.
Thank you. Are there any other questions? Right, thanks. I think we have to move on and note what is in this report. Thank you very much indeed, Sam. Very clear presentation.
Thank you.
So that brings us to the corporate risk register. And Rani again, please.
Thanks, Chair. The July version of the corporate risk register is here for the board's attention. There is one change to the version presented in May, and that is that we are re-escalating, proposing the re-escalate the risk around the exit in the EU linked to Stuart's earlier paper. And that is included now within the paper. The board took a decision earlier in the year to de-escalate that to Stuart's Directorate Risk Register for oversight. There are no other proposed changes at this stage. Just to confirm, as reported in May, that the risks have been assessed in terms of the impact of COVID-19, with no changes proposed.
Thank you. Does anyone have a comment or a question? Mark, would you like to come in, Mark?
Yeah, sorry, Chair. The wheel of death came up when I was trying to unmute the mic, but
okay.
It's done it now. Probably me keeping on again, but CR002, which is the finance in terms of break-even position, given the previous report, my own view is that one, whilst it may not happen at this point in time, should possibly be escalated. I think there's enough there to suggest, with block grants, with the block mechanisms in place and our reliance on commissioning, to actually say that there are additional pressures outside COVID as well. And it's just some thoughts around that one, possibly.
Carol, would you like to respond?
Yeah, thanks very much, Mark. I think we were in two minds about this one in terms of where this is heading, and Pete and I did touch on it. I think at this stage we were looking to see if there was a clearer position from government, but that certainly in terms of if that does not become clearer one way or the other, that we would be having a look at this again for the September board, just in terms of where we were then at the midpoint of the year. So we just chose to hold it at this position. Whilst we were sort of hoping, if I'm honest, Tony's comment earlier about the consequentials, that we may have had something by now, but if we certainly don't in the next few weeks, we would be revisiting this one and the score likely to increase.
Thank you. Trish.
Hi, it relates, I think, to the question I submitted in advance of the meeting. To some extent, I think it has been answered by Carol's earlier paper, but just to make the comment that we have a number of risks in a number of areas, and that really to make the point that we're going to need a lot of capacity within the system in order to mitigate and control the situation, and just to ask how that's going to happen.
Yeah, thanks very much, Tricia, Chair, if I may. I think really, to be quite frank, Trish, that was the purpose of the strategic priorities paper, really, for us all to understand that there's a huge amount going on. We are continuing in the midst of this pandemic, and that the future, even weeks and months, look uncertain. It's a very challenging environment for the whole country, and in particular the NHS and our senior managers and clinical leaders. The key areas of the strategic priorities largely correlate to our challenges on the risk register. And so not taking some of those actions forward would help not mitigate the risk, and taking them forward helps to mitigate and manage the risks. So I think there's alignment there. The honest answer is we are going to be really, really tight on capacity as we move through. We've had a discussion as an exec team, and there are inevitably some of these sort of more business as usual things that can come in and crowd out, and we're going to have to be really disciplined as an executive team and as a board, that we can enable as far as possible the real focus of our resource and expertise on the big strategic issues, which do include operational service delivery, of course, and you've got the winter, and we've got a planned care within those strategic priorities as well. We'll have to keep this under really close review. If it was a matter of money and we thought, let's bring in additional capacity, and in some of the areas of our work, we have put that resource into that resource plan that we've just discussed. But it's very difficult to get the people with the expertise. So it's not just a money matter, it's also a people and resource matter, and the time it takes for that. So staff have been incredibly flexible, needing to adapt and work on different things. I'm afraid to say we are going to continue to be reliant on that level of flexibility and agility, but our prioritisation skills are going to have to be really pretty good over the next few months.
Thank you. Thank you for raising that, Trish, and giving Carol the opportunity to explain, because we know where we are, and we'll be keeping a good eye on it, I hope. Thank you. Did anyone else have a comment then, or a question? No. Okay, thank you. We'll go to the report from the Chief Officer of the Community Health Council. And well done, Katie and Francis, on continuing to engage with your members throughout the period of lockdown. That's quite an achievement, I think, in a place like Powys with all our geographical issues. So would you like to present your report, Katie, just briefly? Everyone's read it. Very interesting. Thank you. And a useful source of information to us always.
Thank you, Viv. Yes, I hope it's fairly self-explanatory. Yeah. There are just a couple of points that I'd just like to pick up, if that's all right, Chair. We obviously suspended our activities as well quite early on in visiting, just to reassure the board that we're currently looking at how we can actually start to do a little bit more with regard to some of the town markets and things like that are currently starting to open. We've obviously also used surveys, electronic surveys, and so we have continued to have input, which has been really helpful. With regard to communication with the Health Board, I have to thank everybody. Hayley and I meet on a weekly basis. Carol and I meet on a fortnightly basis. Hayley and the Chair and Vice Chair meet on a fortnightly basis. It has been brilliant. We also meet with the Welsh Government now, which has meant that there's been a really positive and sort of proactive ability to feed issues in from the ground through to the Health Board and Welsh Government if needed, over a period of a matter of days, which has been really helpful. And I thank the team for listening to and actually acting on a number, the majority actually, of the issues we've raised with them. We currently aren't holding our meetings in public either. We agreed at the executive last week that we will, but I think there's been a lot of lessons to learn from that, and one of them has been we've always been conscious in Powys that meetings have to be held during the day because of the travelling time. Most members, as you all know, it takes a minimum of 2 hours to get anywhere for a meeting, and actually we would hope going forward to be able to use technology so that we can perhaps hold meetings in the evening, so that we can broaden the representation of perhaps younger people, people who are working, people that we don't currently have attending our meetings at the moment. I think the final thing I'd just like to sort of comment on, Chair, if that's all right, is the sort of service change element that's in the paper. Hayley and I, and we had the Services Planning Committee meeting last week, are hoping to meet at the end of August to talk through the process really for some of the temporary and urgent service changes that have had to take place with Powys, and the process for perhaps being more innovative and creative going forward, but bearing in mind the regulations and the guidance that we have in place. So we've both got a commitment, Powys, the Health Board and ourselves, to taking that piece of work forward. It will be challenging. Some of the service changes are quite obvious. If there's been a temporary branch closure because of staffing issues, then that's an urgent and a temporary service change. Others will be slightly more complex, and we'll need to work through those together, not with it wishing to stand in the way of innovation and technology. I think the other issue is an issue that Owen picked up earlier on. We do still remain, as I know you do, slightly concerned about needing to understand the pathways for the Grange, particularly for the communities of South Powys. And then, of course, the need to communicate that with residents of South Powys so that there is clarity on if you scratch your finger, you go to A, if you break your finger, you go to B, and if you chop your finger off, you go to C. And I think that sort of level of clarity does need to be known as soon as possible so that we can start communicating. But appreciating we've got a meeting coming up the week after next. So thank you again for making sure that we have that opportunity to have those discussions. So I think that's probably it, Chair, if that's right. I'm happy to take any questions if your members have any that they'd wish to raise.
Thank you, Katie. A very rich source of information. Hayley, you have a comment or a response?
Yeah, it was really just building on Katie's comments around the complexity for us in Powys is not only looking at what we've had to change locally within Powys, but also understanding the picture with our neighbouring health boards, both in England and in Wales. And clearly that's why it's a bit more complex for us in Powys to work through, which is why we were having this discussion around how we can work this through, because clearly if we take, for example, the digital new ways of working, everybody's put some of these mechanisms in place. So I think there's a question around how we get the right level of discussion, and sometimes that might be about national direction, or it may be about regional discussions. So we'll be working through that detail in partnership with the Community Health Council in Powys. But part of our job will be also making sure the interface is done well with the other CHCs and health boards in Wales and England as well. So it is a piece of work. We have been tracking all the changes to pathways. We've got a really comprehensive log, and we'll be going through that together just to understand the handling strategy for this. And I'm sure it might be probably quite helpful to bring it back to Strategy and Planning Committee once we've had an opportunity to review the work.
Thank you. Owen, your hand is up.
Yeah, thank you, Chair. Thank you, Katie, for the very graphic description of the issues in South Powys. And I just wondered if you just had any thoughts about how you would, given the now sort of truncated timetable, which I suppose we should sort of partially welcome, but how you might be able to deal with any kind of public engagement when we know a little bit more about what's happening with the Grange.
Yeah, so I mean, Hayley and Adrian and I have regular chats about this, and it's a sort of and Carol, and I've spoken to Carol about it as well. You know, we need to understand what the pathways are, and then once those are known, we need to have a discussion about how we're going to make sure that that's communicated, really. And of course, there is the additional challenge that, given our current climate, the traditional ways of communicating, you know, being outside a supermarket or whatever, is going to be quite challenging. So that's going to be part of the conversation I hope that we have on the 12th of August is how we take this forward. But it's a really important piece of work, as I think a paper said earlier, 30,000 South Powys patients actually are affected by this change, and that's a significant population in a rural area. So it's about understanding and then agreeing how we actually communicate it. I suppose my fear, Owen, really is October. It's frightening, isn't that far away? We're heading into August, and so it is something that we need to really agree a way forward. But I'm confident that Hayley and Adrian, we all understand that. It's just a case of being able to be in that position to do it.
Yeah. Okay. And just to give you some assurance, sorry, Chair, just in terms of that and the question, we're already in discussions around what mechanisms we could put in place to try and get that reach, recognising that we can't do the traditional approaches around it. And we did discuss that a little bit in the Services Planning Committee last week with yourselves and the Community Health Council. But I think that there are some targeted groups as well, the hard to reach groups in particular. We've been talking about how do we get some of this information out. So happy to bring further detail once we've had that discussion and debate. But we're already in a place where Adrian's drafting already the sort of mechanisms and ways in which we could do this during this period. And obviously that will come through for due, process through for you to consider.
Thank you. Thank you, Katie. We look forward to your feedback on the way we've managed this meeting in due course. Thank you. Right, now that brings us then to the assurance reports from the board's committees for us to note, and we'd like to perhaps hear about any matters that are being escalated. So we'd like to start perhaps with audit, risk and assurance. Tony? Is there anything you'd just like to draw, a key issue you'd like to draw our attention to? Can you, yeah.
Yeah, fine. Thanks, Chair. I'll be fairly brief. I just wanted to comment on a couple of issues. One, the structured assessment for last year, and also the internal audit annual report. I suspect you remember, Chair, about 5 years ago, you and I met after I was first appointed, and you presented me with a rather long letter said, well, we need to sort these things out from my predecessor, I think it was, if I remember him rightly. Anyway, it's really pleasant to see that we have had substantial improvements in governments over the last 4 or 5 years delivered by the Chief Executive team, because it wasn't a very good position, I think, when we started, but things like a lot of audit recommendations not done and various other matters. And now we're in a position we seem to be on top of that entirely, thanks to Carol driving it through the executive team. And also the fact that the structured assessment last year I thought was very positive. They recognise the work that's been done. And I'd also like to pay tribute to Rani's effort on tracking. She put in an enormous amount of work to get the tracking system in time. We had been waiting a year or two for that to be resolved, and she managed to do it in a matter of a few weeks. And you know, well done to Rani. And I think that governance will substantially improve as that work having been complete. And it's also pleasant to see that we're getting reasonable assurance from internal annual audit comments, which in some years I note that we haven't had in the past. So without going over the top, I think we made really good improvement on governments in the last few years, and I'm particularly thanking Carol and Rani for where we are, and let's hope this, and I'm sure it will, continue in the years come. I think we're now in a reasonably, it's never going to be perfect, a reasonably good position. I don't want to add anything to that. I know you only wanted us to speak for a brief moment, and it's quite unusual for me to be so positive, so I better leave it there just in case. Thank you, Chair.
Thank you, Tony. A lot more positive than the letter I handed to you at the start, I must say. Thank you very much, and for all your hard work.
Thank you.
Owen, next, charitable funds. Do you have anything you want to say?
Not particularly anything I want to escalate to board level, but no, just to say that it's through none of my efforts, but through the efforts of the charity manager, a huge amount of work is now going on, taking the whole thing to a new level, as I keep saying, and people keep giving us money, of course, given the current crisis, so that's a nice problem to have, but Abe is working his way through that, so yeah, loads of really good stuff going on, so if anybody's got time to read the reports, it's really positive.
Yeah, it's a good read, I will say that. Thank you. Very nice, very interesting. Thank you. Mel Davis on Experience, Quality and Safety Committee.
Should I press mine?
No, it's mine. I think I'm on now. Oh, yeah.
Hello.
Okay. Thank you. I'm going to have to just turn Tony off a second. Give me 1 sec.
Tony is off, Mel. Tony is off.
Okay.
Silent.
Okay. So, sorry. Okay, I think that's fine. Thank you. Teething problems. Thank you very much. We've got a broad year with the Experience, Quality and Safety. We've covered quite a lot. So I'd say thank you very much for support, especially with Rani, that's been put into this committee. We've discussed quite a lot of it, and it's quite interesting. We haven't been able to do our self-assessment evaluation this year due to COVID mainly, and the timings. But we will be doing that in February, which will be quite an interesting process, I think. I would just notice on the last couple of meetings, again, we've had other things coming up. We're going to have an update on the Shrewsbury and Telford shortly, so I won't go into that. But we did actually convene another meeting on the clinical framework, mortality reporting and the audit programme, and also the Once for Wales and the complaints management. That was our last meeting, and that was in response to the meeting before where we didn't have enough information and time to go into it. So we convened another one and had a much fuller, broader conversation, which is really pleasing at this point. And I suppose I'm highlighting that just to emphasise that we were able to actually do consideration, even considering the position we're in with COVID and time. So thank you. I don't know if anybody else would like to say anything.
No?
No?
Thanks, Mel. Thank you.
Thank you.
Performance and Resources Committee. I think, I don't know who's going to take this. Mark? Or...
Yeah, Chair, thank you. Nothing to escalate, just wanted to make a couple of observations. I think some positives in terms of the work programme. One was around digital transformation. It's included in the report, but I think the addition of some of Pete's team has given that some real momentum. And again, we've talked about the effect of COVID and the opportunities, if but few, that presents. So that's been great. I think the other thing is with Sam and the presentation of the finance and how that's been pulled together in a format which we can understand and actually get to grips with much easier to get at some of the core and key issues rather than trying to wade through reams and reams of figures. So that presentation, I think, has been quite refreshing. I think just looking forward to a new year when we'll have data to actually judge what performance actually is. As I say, because of the period when that was effectively suspended, it's been extremely difficult to actually make a qualitative or quantitative judgment on many things. But again, more positives going forward, hopefully.
Right, thank you. Any comment? No? Thanks very much, Mark. You've not long taken that committee over from Matthew, and thank you very much and well done. And then finally, I think, is Trish, Strategy and Planning.
Hi, thank you for that, Viv. Just to say that after a period of suspension early on in COVID, that we met again on the 9th of July this month. Really, a lot of what we discussed has actually come forward to board, but we had to have the leisure within strategy and planning. We had the time to reflect and consider particularly the Q2 operational plan and also the podiatry services consultation. I'd like to thank Community Health Council for their role in that. It was really helpful. Again, we did discuss about the Grange and have agreed as a consequence of that it will be taken forward as a board development plan. So we have had a bit more time to reflect and discuss the issues, many of the issues that have come to the board today that are of strategic nature, and just to put that in, just to let people know. So thank you.
Thank you, Trish, and thank you to all the committee chairs. Well, I think that just leaves Carol to tell us about joint committees.
If I may, Chair, just take people to the supplementary pack because there's the executive committee report in there. I just wanted to point that out and not really to bring anything further to the board's attention. You will see that there's already quite a lot that we have discussed through the executive committee that has then progressed to either a board subcommittee or to the board itself. So if that's okay, unless of course there are any questions on that, and I'd be happy to take any.
No?
If not, I can move on. Really in the same vein in relation to the joint committee activity, I would just want to point out two things really that if people do have an opportunity to go and look at the detail that sits behind this, I would just say that one key element from the Welsh Health Specialised Services Committee is that the readiness assessment for the major trauma network and the major trauma centre work has progressed, and a decision was made at the Welsh Health Specialised Services Committee recently to proceed with that, particularly as we go into the autumn-winter period. And then secondly, on Emergency Ambulance Services Joint Committee, I just wanted to highlight that there have been some real performance challenges in relation to ambulance and Red 1. That has affected rural areas in particular, and ours specifically in that. And Jamie and I have had a meeting with the Chief Executive of WAST and the Ambulance Services Commissioner, and we'll have another follow-up one in September with a 4-point plan for improvement. So they were the only things that I would raise from those. I'm happy to take any other items that people may have seen within the papers and want to raise.
Does anyone want to raise any points? No? Okay, thank you, Carol. And, you know, it is worth looking at those in more detail if you haven't had a chance to yet. Although I must say, I have never known a set of IMs who are as good at reading the papers in advance. Trish, you do have a question.
I do. It was one I submitted in advance of the meeting, and I'm not quite sure if I'm jumping a bit, but it relates to the board's advisory groups.
Yes, we haven't quite got there, Trish.
Right. Okay.
But,
I'll be quiet. I wasn't sure.
We'll be there very soon. Okay, thank you. So that completes that item. Then we move to item 3.7. Carol, I think.
Yeah, that's correct, and there, and then we'll be closer to Trish's.
Yes.
So it really is just to present the report for partnership board activity. This is about a number of partnership boards. We, as we picked up through the conversation, are now seeing partnership boards such as the Public Services Partnership Board and the Regional Partnership Board, as well as our joint partnership, a bilateral between the local authority and the Health Board, become re-established, all of those digitally, of course. So that's a good sign, I think, in terms of turning some of our attention to the wider impacts and the partnership ability to respond to the wider impacts of COVID. So really the report is just a high level summary of the meetings. We did meet as an RPB this Monday just gone, and I thought that was a productive meeting. It was really around reviewing the plan for moving forward, and again the strong theme was being agile and flexible and really thinking ahead to winter. And we had a discussion on the Start Well programme, which you will have seen earlier from the strategic priorities paper, is an additional key priority for us to work on in partnership. Other than that, the paper is as it's set out.
Okay. Does anyone have a comment or question? No. Okay, thank you very much, Carol, for that. Now, the update reports from the board's advisory forum. Carol?
Yeah, so just to say, I'm down on the agenda, but I know that Rani has prepared the paper, so it may well that we take this as a double act. But just to bring to your attention the local partnership forum, and if I can thank exec colleagues and in particular Julie in terms of the focus that everyone has had on in recent weeks and months on ensuring that we engage with our local trade unions. It's been very different to the way we would normally engage. It's been more frequent, more focused, and actually I think it's been very productive, and there are some elements of how we've worked that the Partnership Forum would like to continue. So a huge thanks to our trade union colleagues for being so flexible over the last few months. And the thing that stands out most for me is the work that's taking place on the environment and social distancing. And we do have a couple of trade union colleagues who have taken up a secondment to work jointly on the environment. So in particular, I think that's really pleasing. I can recognise that Trish's question really is about the realistic prospect for us to formally establish the group mechanisms, the group and the forum mechanisms that support stakeholder engagement and healthcare professionals engagement. I think it's very clear from audit reports and other mechanisms that we have a good level of stakeholder engagement and our healthcare professions engagement as well. However, we do not have in place the formal mechanism for the stakeholder reference group and the health professions forum to meet. My honest view is that we have got a lot to do in the next 6 months. If we can get to do those more formal meeting arrangements, we will. However, I would like to ensure that we can assure the board that both stakeholder engagement and the involvement of healthcare professionals in our work is fundamentally taking place, even if we don't get to do groups. The chair and I have discussed this on a number of occasions, so we know and we acknowledge how important it is to follow the letter as well as the spirit of the regulations in this regard. I don't know, Rani, if you wanted to add any more.
Thanks, Carol. No, nothing further other than Julie may wish to comment in terms of the Partnership Forum update. I'm grateful to Liz in supporting that constant briefing type approach through the past couple of months.
Indeed, thank you. Yeah, Julie. Julie,
sorry, no, I didn't click it quickly enough. I think it's all been said actually, and our partners have been superb in working with us and helping us through the wellbeing hubs. I must mention those as well. They jointly sponsored those with the charitable funds, and the TVs that have been getting messages out to staff have been fantastic and well received. And I think you've already mentioned the social distancing work, and our trade union colleagues have actually been released to support us with that work, and that has been a really good example of partnership.
Thanks, Julie. Trish, do you have a further comment on the other two fora?
I take on board that we do get the feedback and the involvement of stakeholders in the third sector and also of our clinical partners. I do think it is important that we have as wide a wide range of views presented to the board, but I acknowledge that we're in a difficult situation. I've already alluded to the fact that I understand that, but I think it's important that we do seek to extend the involvement or maintain the involvement that we have, and that those the views and understanding of those groups actually feed into our decision making.
Yes, and as a lawyer, I feel slightly embarrassed that we're not meeting our statutory requirements in that respect. So it would be a great pleasure for me to see those two organisations set up. We have actually established our stakeholder reference group, and it has met. And so there is no reason why we shouldn't continue, perhaps, to refresh that. Health Professions Forum, that's a good opportunity, I think, once we can clear out of the way the current difficulties and challenges that we have to meet during COVID and the Brexit period. Right. Now, any other urgent business? Yes, we do have one item, and I am a great believer in evidence, so I'm going to fetch some evidence. Here it is. Evidence. Wynne, our medical director, is retiring. And are you there, Wynne?
I am, yes, I can see.
We have
evidence
something which I can virtually present, if not actually. And certainly I can't shake your hand, even if you were in the room. But thank you very much for your contribution to Powys Teaching Health Board. And I note the beard. Is that in honour of your retirement?
Well, it's become fashionable amongst.
I know. I've noticed. I know. I've refrained from commenting on others. I noticed Tony doesn't have a beard, but there we are. These are what I would be presenting to you personally if I could. And thank you very much indeed for what you've done for Powys during your time with us. Very good luck for your retirement.
Thank you. Thank you very much, everybody. It's been an interesting 2 years, and I wish the Health Board every success moving forwards. And I'll continue to watch what happens in Powys, but from another part of the country. So best of luck to everybody, and thank you.
Thank you, Wynne. Thank you.
And with that, I'm closing this meeting half an hour early, which is very nice. So the next meeting will be on the 30th of September at 9:30, venue to be decided later. Thank you very much. Thank you.
Thanks, sir. Thank you.